Let's talk about basal cell carcinoma nose. Very small topic. So look at the diagram. You can see the picture of the basal cell carcinoma of the nose. So it is one of the commonest site of presentation of basal cell carcinoma. You can see this margin are heaved up. There is a very small, like some sort of furuncle like picture with a little bit of erosion. So basal cell carcinoma is basically most common malignancy of skin of external nose. That means if we talk about the external nose skin, so the most common cancer occurring at this site is the basal cell carcinoma, and shortly we say it BCC. Okay, it arises from keratinocyte of epidermis, that is the outer skin layer, or the adnexal structure, that is a structure related with the skin. So it arises from the keratinocyte of epidermis and adnexal structures. Generally, prolonged exposure to the sun is a major risk factor. So prolonged exposure to the sunlight is a major risk factor, and elderly males, because males are working in the outskirts with the prolonged exposure to the sunlight, so they are at more risk. So it is more common in the males, and that is also elderly males. It is also known as rodent ulcer. Why this is known as rodent ulcer? Because it do local burrowing. That means like how we see the mouse or the rodents, how they goes inside the sand or the land. So they will make a burrow. They will dig out the hole and make a burrow and goes inside. So that's how this BCC present. It will make a local burrowing, goes inside the skin and then expanding. So that's why it is known as rodent ulcer, and it is generally locally invasive tumor. That means doesn't spread by means of the lymphatics and going to the distant side. It is generally spread locally. So what is the advantage of that? So in treatment, if we do the wide local excision, so that will be the best treatment to treat the basal cell carcinoma. Okay, because this is doing the local burrowing, so we will remove the complete lesion. And what else we will do after removing the complete lesion? We will put also remove some of the fresh margins, because it do the local burrowing. So get the best result, it is being managed by the wide surgical excision, also known as Mohs micrographic surgery. It has been asked in the exam previously. So that's how we treat the basal cell carcinoma, and sometime post surgery there becomes a defect because we remove the tissue, so defect, open defect will be there. So what we can do is the skin grafting or some sort of pedicle flap can be taken and then reposited here to cover up the defect. So very short introduction about the basal cell carcinoma. So I hope that's all. Thank you.